name's Karen White. I'm the CEO of Missouri Highlands Healthcare. Missouri Highlands is a federally qualified health center. We've been in existence since 1975. Our roots were very small. We started basically as a free clinic in the basement of a health department, and we've grown from there. Whenever I started, we were in 4 counties, and now we have expanded to the 7th county this last year whenever we opened up in Wayne. Really and truly, Missouri Highlands' passion and my passion is around serving those that would otherwise go without the needed health care that we are able to provide. Last year, we served over 22,000 patients in the 7 counties that we were at, and that is important. We live in a very rural part of the world. We love it here. It is definitely rivers, hills, trees. All of us have a great work-life balance around working hard each day, and then of an evening and on weekends, truly enjoying ourselves and the area that we live. But the 22,000 people that we served this last year are truly our friends and our families and our neighbors. I always say these are the people that I see daily at the grocery store, the gas station, church, school functions. And that's what is so important about what it is that we do here at Missouri Highlands. We get to take care of the folks that we know, and they trust us. We are that trusted person that they can come to in their time of need, and we can provide the care that they need, whether that be through our medical clinics, our dental clinics, behavioral health, substance use disorders, and our women's clinic that we just recently opened. It is so critical what we do day to day. It really does make a difference in somebody's life. So if you're looking for something to make a true difference in the life of another individual, then coming to work at Missouri Highlands is the place for you.
I had the opportunity to come back to Doniphan. I was born and raised as a rural Ripley Countyan. Then I went to Southeast Missouri State and was able to achieve my degree as a family nurse practitioner. And I have the honor now to take care of my friends, people who basically raised me in the community. And there's no greater feeling than that. It feels like you're making a difference every day in a community that poured so much into making me as a person. I get the honor of taking care of friends of my parents and friends of my grandparents, and hearing stories about my family, through the years. So really, there's no greater care, in my opinion, that can be given than someone who holds each patient as an individual that I've known. I know their family, I know where they went to school, I know everything about them. They're not just a patient to me, they're someone I'm going to run into in the grocery store, and there's someone who their child is going to play ball with my child. And so I take my job very seriously. My original training was in internal medicine and nephrology, so some of those patients who need that complex care, I can use some of that experience that I've gained and bring that home and try to use that to help take care of these patients and to try to teach other providers in the areas, some of the things that I've learned. As far as why work for Missouri Highlands, we have so many opportunities for patients. Really, as far as finding roadblocks, that really isn't an excuse for us. I've been with Missouri Highlands for 5 years, and when you get to watch a child grow and flourish like that, you take absolute personal responsibility, and there's no greater honor than for someone to entrust you with the care of their child. And to get to do that to the people who helped build you as a person it's phenomenal.
I chose Missouri Highlands because Missouri Highlands' mission, it focuses on serving the community. This is my hometown community, and coming back to Poplar Bluff was always a goal of mine. Missouri Highlands focuses on those that sometimes are left out, those that don't have access to care, and those that sometimes are a little bit more challenging to serve, and that was really attractive to me as a provider. I get to do something different all the time. I'm not focused in on just one thing.
I love being able to work for Missouri Highlands, and I love giving back to my community. I love seeing all of the children that we see and helping them to understand how important it is to have good oral hygiene and take care of themselves, because a lot of our community, they don't understand that. They're underserved and they need us to teach them those things.
I think it's also a good thing that we have the support through different grants and different funds. With us being an FQHC, we have awesome equipment. We get to use state-of-the-art materials and really serve our patients and provide good quality care, not just that we're actually giving them the care they need, but we're providing great quality of care here.
So I take a lot of pride in working with Missouri Highlands Healthcare at the Annapolis Family Clinic, because I feel like every day I can make a difference with every single patient in some way. A lot of our community relies on me every day to take care of at least one need for them, and it makes me happy to do that. Whatever I can't help them with, that's the great thing about the clinic flow, is the nurse can help them, and then the nurse practitioner can help them, or the counselor. So it's nice to know that as a group, we're going to be able to fulfill someone's need. At the end of the day, we all have the same goal, and that is to take great care of our patients.
The future's exciting here. We currently have 2 additional nurse practitioners that provide care in the women's clinic, Jodi Spain and Sonia DeCiro. The hope is to expand in all aspects, more providers, less wait time, better care. Our OB clinic has 2 ultrasound rooms which provide both obstetrical and gynecological ultrasound images. We have 2 3D 4D ultrasound machines, and we are the only clinic in Poplar Bluff that has that capability.
I think one of the best things that we do as a practice here is where no matter what one of our ladies come in complaining of, we find a solution for that, whether it's a menopause problem, a contraception issue, something that they really don't know how to handle, we can find a solution for that.
Whether it's in-house or a good referral source, sometimes to specialty care beyond what we're doing here. I agree. Sometimes we're seeing a lot of pathology with vulvar issues, women who've had some sort of chronic itch or problem for years that they've battled. And if we can't help them here, I feel like we do a good job of at least referring them elsewhere.
I agree.
I feel as a provider, it's very rewarding working in a rural area where you feel like you can meet the needs of the patients that do face many barriers to healthcare. It's been a great experience for me to reach out to those patients, to help them to find ways to meet their needs while being mindful of those barriers to care that they have, such as financial restraints, transportation, many things that they face that people in an urban area cannot imagine till you've had to live through that. The other thing that's great about working for a rural clinic is the student loan repayment is always a plus. I graduated with an exponential amount of student loan debt, and by working in a rural clinic, I qualified for the National Health Service Corps student loan repayment program. So that has been amazing to cut back my debt and to make it to where I wasn't having to take that large amount of my income and lose that to student loans. So it's been very, very helpful working for a rural clinic where I did qualify for that program.
One thing that I am very grateful for working for FQHC is that I was able to receive a loan repayment to help repay all my student debt through the National Health Service Corps. It took me 3 years, and I was debt free from school. So that was very rewarding. That was a very big incentive for me to come and work for Missouri Highlands.
I have had the opportunity to be a part of the Missouri program. The National Health Service Corps is more of a national-based program, whereas Missouri has their own for dentists. And as part of that, I am also getting some loan repayment to help with my student loans. So there's national programs and state programs, and Missouri is one of those states that offers a great program as well.
One of the biggest benefits of coming to work at Missouri Highlands is the work-life balance that our team members can achieve. We offer a robust paid time off package that includes 32 days of paid time off plus 8 paid holidays a year. We really do place a high emphasis on self-care, on taking care of your family first before work. It is hard as a working single parent to sometimes balance everything that needs to be done in life. And so that's one of the reasons why I love doing what I do, is that my team members share the same philosophy I do. We take care of our family first. We take care of ourselves so that we can best take care of our patients.